In this video, we will be discussing about Herpesviridae family, also known as human herpes virus. It has icosahedral symmetry and double-stranded DNA. We know that the largest DNA viruses are the pox virus. And after that comes the human herpes virus, ranging from 150 to 200 nanometer. The first member of this family is human herpes virus 1, known as herpes simplex 1. Then the human herpes virus 2, known as herpes simplex 2. Then comes the human herpes virus 3, that is herpes zoster virus. The fourth human herpes virus is known as Epstein-Barr virus. The fifth virus of this family is cytomegalovirus, and as its name suggests, it is the largest member of this family. Then comes the human herpes virus 6, 7, and 8 respectively. Herpes virus is further classified into subfamilies as alpha, beta, and gamma. The human herpes virus 1, 2, and 3 comes under alpha, 4 and 8 under gamma, and the remaining ones, that is 5, 6, and 7 under beta. Simple. Now, about the site of latency, where they go and sit. So the alpha ones, they go and sit into the neurons. The gamma ones, they sit in the B cells. And the remaining, that is the beta one, they sit in the glands and the T cells. Now we'll be discussing about herpes simplex 1 and herpes simplex 2. Starting with the pathogenesis, the herpes simplex virus establishes infection in the mucosal epithelial cells and leads to form vesicles. This virus can infect nearby sensory neuron. And from there, it can travel up to the axon, to the cell body, to establish lifelong latent infection. Stress triggers reactivation of virus in nerve and reoccurrence of vesicles. The main key point about herpes simplex virus is anything above the waist is because of herpes simplex 1, and anything below the waist is because of herpes simplex 2. Now, this thing will help you learn everything so easily. Just wait and watch. Starting with the clinical features. The orofacial lesions, encephalitis, meningitis, ocular lesions, these are all much above the waist. So, these are because of herpes simplex 1. Genital lesions and neonatal herpes, that is occurring from mother to child, it is below the waist. So, it is caused by herpes simplex 2. Starting with orofacial lesions. The most common site is the buccal mucosa. Most common primary lesion is gingivostomatitis. Most common recurrent lesion is herpes labialis. Now about the encephalitis. So herpes simplex 1 is the most common cause of acute sporadic viral encephalitis, and it usually occurs in the temporal lobe, as you can see here. Now, meningitis. It is above the waist, so it is caused by herpes simplex 1. But when we talk about molarate meningitis, it is caused because of herpes simplex 2. Ocular lesion. When we are talking about ocular lesions, we are talking about dendritic corneal ulcers, as you can see here. Now, the genital lesions. The genital lesions are bilateral and painful vesicles. You can see here. Now, other clinical features like herpes gladiatorum, also known as wrestler's herpes, because it is seen in wrestlers. The other one is herpetic vitiligo. It is seen in healthcare workers and mostly on the fingertips. Now about the transmission, as it is anything below the waist, so it is transmitted through sexual activity and vertical transmission. And this is anything above the waist, so it is transmitted through mucosa and skin. About the age, children will be affected because of herpes simplex 1 and adults will be affected because of herpes simplex 2, except the neonatals. Now about the latency, as anything above the waist, so trigeminal ganglia will be under herpes simplex 1, and anything below the waist, so sacral ganglia is the latency site for herpes simplex 2. Now about the diagnosis. The first one is zinc smear. First we will unroof the base and then scrape it, and after that we will apply these stains. What we will see? We will notice this multinucleation and molding, that is, they are fitting into one another, and also margination of chromatin will be seen. The other test we can use is PCR. Why? So zinc smear cannot differentiate between herpes simplex 1 and herpes simplex 2, but PCR can. Now the last thing to discuss is treatment. So what will you give the patient? You will give acyclovir. But what if resistant? If resistant, then give foscarnet. Thanks for watching. Don't forget to like and subscribe and share with your friends.